From the News Channel 5 network, this is Open Line.
Hello, everyone. Welcome to Open Line. Glad you're with us. Happy Tuesday. It's November 17th. Tonight, we are giving you some information that will be very valuable. We're talking about, as you're signing up for Medicare, what do you need to be thinking about? And also talking about if you have a loved one who may be aging, what are some things you need to be thinking about? So that means we are talking with our friends from Takis McGinnis Elder Law. Happy to have two people from that firm joining us via Zoom, as all of our guests do. Thank you both for being here. We have Chris Johnson, he's a partner with Takis McGinnis, and Josh Hunter, Medicare specialist, public benefits specialist. So thank you both for being here.
Thank you for having us, Ben. It's a pleasure.
Glad to be here. Yes, sir.
Well, so Chris, all right, let me start with you, Chris. Let's define, first of all, elder law. How would you define that?
So I would define it very simply. For those who are reaching retirement age and above, who are looking to make sure that their affairs are in order, and everything from basic estate planning, making sure as their proverbial ducks are in a row, all the way to advanced planning, asset protection, qualifying for TennCare, qualifying for Medicaid TennCare, and making sure that everything is squared away and that we are taking care of them and taking care of their personal, legal, and financial needs and doing it over time, because we all know our lives are not static. They're very dynamic. Tomorrow is never promised, and we want to make sure they have a plan in place that can deal with the twists and turns that life throws at us.
And Josh, your role there at the firm, and you're both at the firm, right? You're both there right now, just kind of in different rooms. That's the way we all operate now. It's so bizarre.
Yes, sir. Just down the hall.
Just down the hall. But your role is you do what?
I'm a public benefit specialist here at the firm, and my job is to try to make some of these public benefit programs a little easier to manage, a little easier to understand, and of course, let people qualify for the benefits that they already should have. I work with Medicare and VA here at the firm, and we have another public benefit specialist who just works with TennCare.
And so you see the number at the bottom of the screen. I encourage people to call in. If you have a question, this is a great opportunity to get that question answered. If you have a story you want to share about a situation you're going through, I guarantee you others can benefit from hearing your story. Then we can have, either Chris or Josh talk about it. But Josh, what about right now? Right now is a pretty important time, right? Because people are signing up for Medicare benefits right now. Is that right?
Yes, sir, you're right. At the moment, we are in what's called the annual enrollment period between October 15th and December 7th. It's an important time for people who are new to Medicare, and it's equally important for people who already have their benefits in place in determining what's the best fit for next year, regardless of if their coverage was good, bad, or ugly this year. It's all about making sure it's the best fit for the coming year.
And are there big changes? I mean, what would you say are the headlines as far as changes or that people should be aware of as they're signing up this year?
Yes, sir. I think that's a great question. It's something that confuses a lot of people. I think the general public would like to get their insurance in place and never have to mess with it again. But sadly, that's just not the way that Medicare functions. Particularly during this time, we're mostly talking about drug plans or Medicare Advantage plans. And just to put it simply, they can change from top to bottom from year to year. They can change their premium, they can change deductibles, they can change, most importantly, their formulary, and they can also change which pharmacies they choose to work with or cut out of network or change that setup. And it can affect you in ways that can save or inflict your family thousands of dollars. It can make a very big difference to just at least check and know what's good for you next year, not this year.
And none of us a year ago would have seen what's happening this year. And so, Chris, I ask you, how is COVID impacting, what you do, elder law, and just what's going on there in your office right now, what you're seeing?
Well, I think first and foremost is our client base is one of the vulnerable groups, and so we take this exceedingly seriously. And I think, like all businesses out there that are being prudent, we have established a contact tracing program. We have everyone masked up in the office. We have obviously copious amounts of hand sanitizer, and we disinfect an office after a client meeting. It's all about protocols, the proper procedures to make sure everyone's safe. We've done a great job. Since we've moved to the new building, we have a lot more room, and that provides ample space for social distancing. And it's just embedding all of those protocols into our day-to-day operations to keep our staff safe, to keep our clients safe. As you said, this was not something we could have predicted. I don't think this is something anyone could have predicted. And after March, when the shutdown started, that we're still kind of dealing with it here 8 or 9 months later, I think we're all a little stunned. I think we're all very hopeful for these vaccines, with the trials sounding like they're wrapping up, and it looks like they may be transitioning to a distribution phase soon. We're hopeful, like everyone else, that they get these vaccines to the most vulnerable groups first, and let's take care of our elderly and our senior citizens, and then hopefully we'll start finding some normalcy come 2021.
Boy, yeah, you hit some big words there. We're all stunned, I think that's right, and we're hopeful about the vaccine, and we're looking for normalcy. There's just no doubt about it. And with the population that you're talking about, nursing homes are always part of the conversation, and nursing homes are one of the areas that were hit hardest in all of this. And so if you have people that are coming in talking about, that next stage, how again does COVID impact that? What do you recommend people be thinking about if that's what they're kind of looking at?
Well, I think when they make a determination on facilities, I don't think that determination has changed, because what was important pre-COVID is what's important during COVID, and that is our mom and dad safe in this facility. And it is the facilities, they were hit very hardest up front, but at the same token, that also caused them to kind of respond the strongest and put together the robust protocols very early on. I think while other businesses out there had the luxury of time to kind of feel this out, the nursing homes, they didn't get that. They had to deal with this right up front. And we had some right in our own community here that it got a little scary for immediately. But I think they've responded very well. I haven't seen, knock on wood, on the news any more reports of like mass outbreaks at these facilities, because I think their protocols are very strict, because they understand the vulnerability of their population. And at the end of the day, when you're looking at a facility, when you're making that decision, what you want to know is, what's the history? How have they been handling this over the last 8 or 9 months? And the one good part, if there is a silver lining in this dragging out, is there's a track record, and you can see how they've responded, and they can demonstrate that to potential residents and what the pros and the cons are. I think the hardest part for any of the residents these days is there has been a real isolating effect, because the visitors allowed in are really restricted, and that can be tough from a mental health standpoint, and they have to factor that in and balance that as well. And it is a very difficult task. I don't envy them for trying to factor in all these things. They need to keep the residents safe. They need to keep the families happy. They need to keep the staff healthy. And when you're trying to balance all those interests, it's very difficult. And frankly, I think they're doing a very good job under very trying circumstances.
Wow. Yeah, that's a very good point. All right, we have some calls coming in. I want to go ahead and start taking calls, because again, I think we can all benefit from maybe a story or a question that people have. We have Diane here on the line. Hello, Diane.
Hello, how are you?
I am doing well. Go right ahead. What's on your mind?
Okay, if I keep, which I have Medicare insurance, and then of course I have my supplement, and if I decide to keep it for 2021, and then during the 2021 year, I have a medical emergency such as a heart attack or cancer, then at the end of 2021, when it's time to go through a new enrollment, will I still have to stay with the supplement that I have now, or will I be able to get something else, or are they going to say, well, you have a pre-existing illness and you can't change?
Interesting.
You've asked a solid question.
That's a
Miss
great
Diane,
question.
for sure. I think the
Well, that
first
is
thing
my fear, because right now I have the supplement is the least that you have, which is 0 payment, because right now I have no illnesses.
Okay. All right. Well, let's ask Josh this. All right. Thank you, Diane.
Okay.
Thank you. We'll ask Josh. All right. What about that?
Yeah, so she hit on a good point. I think the first thing that we want the audience to understand is that means Miss Diane is on original Medicare. So some of these answers may not apply to the listeners who have Medicare Advantage. Now, what she's discussing is original Medicare comes in multiple parts, right? So she has her A and B, which is inpatient and outpatient. Hopefully she has a standalone drug plan, but she didn't mention that yet. And finally, her question concerns her supplement, which pays for the 20% that Medicare doesn't, right? It fills the gaps. That's why sometimes we hear it called Medigap. So she was asking how that's different. Well, first of all, that's not necessarily what we're talking about during the open enrollment period. I had a volunteer who worded it so well back in the days that we date our drug plan, but we marry our supplement. You can change them both, but one takes a lot more work. So the drug plan we need to review every year. We definitely need to check on that. Supplements can change, but when you're first eligible for Medicare, you get something called guaranteed issue rights. And that is where they will not ask you medical underwriting when determining your monthly premium. So her question is, if she has some big medical event, should she change her supplement or not? Well, hopefully not. That's why we always want to pick a good supplement up front, something that covers us well. But she can change her supplement in the future if she needed to, but she'll be subjected to medical underwriting. So in the portion of her question, she said she had if there was a major medical event. Well, that's likely going to give you a hard time getting through medical underwriting. They can raise your premiums dramatically, or plans can actually deny you coverage. So it depends on the situation, but just note that changing supplements brings special considerations and concerns. You definitely want to talk to a professional and be careful to do so, because guaranteed issue rights make a big difference.
So, all right, that's interesting. So I don't understand everything about this, but you're saying you sign up for a supplement right when you go on Medicare, and it's important, you need to stick with that. I mean, you're probably going to stick with that, because if you get some major illness, it's going to be tougher to improve that supplement. So you sign it. You would recommend getting something, a really good supplement early on when you sign up. Is that right?
That's exactly right. Yes, sir. Because when you first sign up, those guaranteed issue rights are going to give you the opportunity to lock in a rate at the lowest it will ever be. Because due to medical underwriting, we don't get any younger, we don't get any healthier, so those premiums only go up from there.
And if let's say you didn't get the best one the first time you signed up, but you haven't had a major health issue, and you're a few years in, would you recommend now upgrading? Upgrade as soon as you can. Is that what you're saying?
That's exactly right. If you have any wish to change your supplement, it's better to do it sooner than later. That's for sure. Now, just to put it in a different way, we had 2 supplement plans go off the market this year, Plan C and Plan F. People have still been grandfathered into those plans, but their premiums are going to skyrocket over the next couple of years. That's something that a lot of the companies aren't actively telling their people. So we've actually been telling our clients to look into Supplement Plan G, go through the medical underwriting, and see if it's worth changing to save yourself all of this added expense in the future. And I could bore you with the details of the numbers, but to answer your question quickly, yes, sometimes the medical underwriting is worth it if it gets you a better coverage for the cost for the remainder of your life.
All right, well, that kind of sets the table for our discussion. Okay, good question. Diane, thank you for calling in with that question. Good discussion. Happy to have with us Chris Johnson, Josh Hunter, both with Takis McGinnis. If you want to call in, we'd love to hear from you. There's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.